what if somebody has a fluttering heart, or they can feel their heart, or somebody says, I can tell my heart's pounding? How do you, when you hear that from a patient, what are you thinking about?
So with that, we think about arrhythmia, or irregularity of the heart rhythm.
So what are some of the rhythm problems that somebody may have if they come in?
So most of the rhythm problems are relatively benign, meaning you don't die or have a catastrophe, but it's extra heartbeats that might come from the upper chamber of the heart or the lower chambers of the heart.
How do you know if it's coming from an upper or lower chamber? Is either one of those more problematic than the other? Do you find this on the electrocardiogram?
So we usually start with an electrocardiogram or an EKG, and that gives us about 10 seconds in time. An EKG does. Otherwise, we may do a longer monitor, and we'll monitor somebody for 24 hours or even 30 days, and that can show us the rhythm abnormalities.
So what are you looking for that would make you nervous? If somebody's got extra beats from the upper chamber, lower chamber, atrial extra beats, ventricular extra beats?
Right, so the atrial are from above and the ventricular are from the lower chambers. The ventricular beats are more concerning for us, particularly if somebody has a history of heart disease or a heart attack or a weak heart, then those extra ventricular beats can be more of a concern.
Do you ever pick up a run of abnormal beats? Does that make you worry even more?
It does. And the longer and the faster and the longer, that's more severe.
How about people that suddenly get a rate of 150 to 170? I think SVT, what does that mean?
So that originates from the upper chambers, and that can happen to young, healthy people. That does not necessarily have to do with heart disease like blocked arteries. But it's an electrical problem, and that can oftentimes be treated either with medication or with a procedure called an ablation.
So those can get rid of the upper chamber fast heart rate.
Yes.
How fast is that heart rate usually?
Well, so a common one will go at about 150. That's called atrial flutter. And there are some that are SVT rhythms that will be 180 or 200, and that's really flying. The person feels it.
So if the heartbeat is 150 or 170 or 180, does the heart not have time to get a forceful pump, and what symptoms does the patient have?
Right, so the person feels racing of the heart, palpitations, racing of the heart. Sometimes they'll be lightheaded and they might feel like they're going to faint.
So if somebody has an abnormal rhythm like that, medications, and then would you put something to record their rhythm to make sure it's working?
We do. We can even place an implantable loop recorder under the skin, and that's very helpful for a longer term recording. Records up to 3 years.